Sir, so speed was a very no-brainer. It was basically my seniors who told me. I think it was you have to take speed. There was no other alternative to the videos. Like I think speed has been, sir, excellent. The videos, your sessions on general surgery, those 9 to 10 p.m. sessions. Because you're done with the day and now you're thinking up what should we do now, and then you come on the screen and they're like, okay, 10 questions, 15 questions. There's people typing on the answers, and you keep asking that write the answer on the chat box, write the answer on the chat box. At that time you think "Ki, why should we do this?" But in retrospect the answers start coming from the spinal reflex, because you think that okay, you have seen this question somewhere. I really want to thank speed, I really want to thank you.
So I bring in all the wishes and greetings on behalf of all the faculty members of Speed Medical Institute to Dr. Aayush Bhadani for scoring a AML rank of 10 in MCQ'S surgical gastroenterology, his dream specialty of his choice, in NESS session November 2025. Congratulations to you.
Thank you so much, sir. Thank you so much.
Great and wonderful to meet you at this occasion in your success story. Can you share about your brief background, where you started till date, what all you did?
So first of all, I just want to say I've been manifesting regarding this interview since the day I've started preparing. This was from my PG days. You had come to my college, Ajikar Medical College, in my UG, and you had given me a chocolate to when I gave the when right answer. So
Wow.
I have so there's a long story, and so I did. So therefore, I did my undergraduation from Ajikar Medical College and Hospital, and I'm a 2015 batch there. I joined AIMS Patna 2022 September. So I've just passed out in September 2025, and this was my first attempt, sir. After I passed out, I took around 2 months to prepare. That was October entirely and November, and this is just surreal and unbelievable for me.
Great, great, really great. Now, I could see your preparation. Can you say something on your preparation success story and preparation strategy? What all you did to achieve this? And can you tell us something on a lot of board pins and a lot of stickers and notes? It's quite inspiring. Your wall is inspiring for me.
Sir, so this place is the same place where I did my PG preparation. I belong to Ranchi. So this is the same room, and the wall now, which was filled with the PG notes, is now filled with all the SG small clippings, all the important tables, and my board on the back is now having the NEET timetable, because I have only 10 days now to prepare, but thankfully I have a rank now, so I can relax. Sir, as I come from AIMS Patna, I had exposure early on to surgical gastro. In my second year, we had a rotation. So even my seniors have been part of the central institutes for their MCH programs. I knew about Basant sir and speed right from second year. So I took the speed module in third year, and I didn't have much time, sir, because I was it's a busy residency program. So I managed to go to Japan for observership through the Torrent Young Scholar Awards to
Congratulations.
Professor Makuchi Center. And that was the turning point where I saw robotic hepatectomies. I met Professor Kawaguchi, and even my professor, my head of the department, my SG department. All of that inspired me to take up SG. I was in two minds, sir, initially, whether I should go for minimal access or SG. But then I decided that I would want to do NSG. Therefore, I then started watching the videos in the month of October, and I took around 1.5 months to watch the videos. I knew, sir, it was impossible for me to match up the amount of knowledge which my seniors or other people who have been dropping multiple times have is having. So my bet was on getting a good general surgery, all the questions correct, and a good interview. And sir, I would just want to tell you that I managed to get almost 29 out of 30 general surgery questions correct. SG was not great because obviously, sir, I had very less preparation. And so my CML rank was 38. And I think 39 people got an interview call. And it was then entirely my interview which made me jump from 38 to AML 10. And sir, I just feel that, when you want something, when you desire something, it happens. And I always say, sir, off to something great. So this has been my tagline for very long now. And deeply inspired and very humbled, sir. All your classes, all your evening lectures. Those 8 a.m. I still remember the day when you were saying, why have you not filled up the SG form? You should, go for the INISS form, fill it up. You can do it. And you said that you told about your journey. You told us that how it is easier to qualify SG or the INISS compared to NEET. And now when I'm thinking about it, now I have to study plastic surgery, neurosurgery. It is a very daunting task. And I'm so relieved that I have a good rank and I will get a seat in the INI. So this has been a short journey for me, sir.
Excellent. Truly inspiring. Your story is big and fantastic. And you conceived it and executed it perfectly. And I'm very, very happy for you. And can we know how many questions did you attend and what was the paper towards? What was the interview? What were they asking you? Can you share something on that?
Sir, so I was sure that I had very less time, so I could not focus on Bloomgart and Shackleford. And I will be honest, I have not read them. I read Bailey and Saveston because there is a very good academic scenario in Ames Patna. It's an excellent academic scenario. And I had also prepared for TISA, so I had some good backing on the general surgery portions. I just built it upon it, and I knew that I have to get a decent number of questions correct, and attempt should be good so that I can make it through the interview. Because my seniors kept telling me, if you give an interview good, you will get a rank. So I attempted 77. There were three questions, which was a little difficult for me. So I just left them. And I still remember I spent the last 4 minutes on one statistics question. And if I had made that incorrect, I would not be sitting here. And sir, after that, I think for the interview, I watched all the Basan sir's recorded interview sessions. And I spoke to Basan sir as well. I spoke to all the seniors who have gotten. All of them told me that when the paper is easy, because this time the paper was a little on the easier side because of the general surgery part. And I was so surprised that they asked all the shackle for new updates, which Basan sir like covered in the last few classes, but still said like they are so pro. They want to take the best of the best. That is how the INA-LG exam is. So I just focused on the interview. In the interviews, they asked me approaches. There was two approach: upper GI bleed and approach to patient having fever on post-op day one. I think this was a common question to most of the people. The head of the department of AIMS Delhi, Dr. Sujapal sir, took the interview, and there were spotters. Again, spotters were, we knew sir the ABG would be coming, some stats would be coming. There would be an intra-op, there would be a specimen, there would be an instrument. No one knows what instrument was asked till date. I've asked so many people, but at least I could manage the other parts because I had been practicing for it. And I said I really want to thank ChatGPT for my success. AI tools have been amazing. I've been using them for the last 2 years, and I think I used it for my interview to fetch diagrams, to fetch flow charts. I used to rehearse interviews with ChatGPT online on the web mode, and he used to ask me questions. I used to tell him the answer, then he would correct me, tell me, no, no, this is not how you should say, this is not how you should do. So I think
Wow.
all of this, it just feels surreal. I just wanted it really badly. And so there's this common consensus that SG to nahi hoga, it's very difficult. You must take multiple drops, multiple attempts. And I have my senior also, Dr. Hamza sir. He has been so consistent, and for that one rank he took around two or three drops because he wanted that Ames Patna seat. So just motivated me that okay, when your seniors can get it, you can also get it. There were very few interviews, I think, of people who just got it in their first attempt. So I started doubting at one point of time, but then so I just thank like God Almighty, my parents just feels amazing.
Great, great.
Sir, so speed was a very no-brainer. It was basically my seniors who told me. I think it was you have to take speed. There was no other alternative to the videos. Like I think sir rules the game. Basan sir rules the game. And so I just took it in my third year. It was a 1 year program which is ending in the January 2026. And I honestly didn't have a lot of time in the beginning. For my MS finals, I did watch a few lectures. And when I was in Japan, I watched a few lectures of liver transplant of sir. But mostly it was in my October when I completed my MRCS part A, and then I'd come back to Ranchi. Then I started preparing. So speed has been, sir, excellent. The videos, your sessions on general surgery, those 9 to 10 p.m. sessions, because you're done with the day and now you're thinking up what should we do now, and then you come on the screen and they're like, okay, 10 questions, 15 questions. There's people typing on the answers, and you keep asking that, write the answer on the chat box, write the answer on the chat box. At that time you think, "Ki, why should we do this?" But in retrospect, the answers start coming from the spinal reflex because you think that, okay, you have seen this question somewhere. So
Correct.
I think all this just lost our words at time.
Great.
Yes.
Yeah, that's the reason why we always practice be live, be live. And
Yes,
don't
I
give
think.
just 1 year old or 2 year old pre-recorded ones. May not be useful because students will be demanding, exam will be demanding for the students. If they are not
Yes.
onto the latest edition of books, latest updates, and the rank we can miss. So
100.
and that is the policy and the culture we follow at speed, so that students can be into the system. So very good that you have utilized all the services. And also, what is the one word that you want to give for the future aspirants of SGE?
Sir, it's a Hindi phrase by a senior teacher. He always used to say, "Chah loge to pa loge." I think that is very important. The want, the desire is very important. There is always that we want to do it, but we don't put in the hard work. Sir, I think hard work is very important. Then definitely there is luck. When I feel I I don't know how much hard work I put, but probably it was enough to impress the Almighty that He made me jump from CML 38 to AML 10. Because when I saw my CML rank first, I was shattered. When I saw my AML rank, I started crying. My mother thought I didn't make it, but then I told her that I would be getting an AM seat. What if I get AIMS Patna only? So it's just that, sir, you have to have that want, sir. I think it is doable. Yes, it is challenging. So many people are have huge amount of respect for people who have been dropping, doing reading Bloomgard, Shackleford. And I don't say that, sir, reading not reading books is a substitute. You have to read books. I just got lucky, probably. I focused. I did some smart work. I don't know what I did. Just I had very limited time, sir. It was impossible for me to study the hardcore books. So I focused on, because the general surgery is also important. 30 questions make difference. And that was a very strong portion for me. So I just focused on that on the interview. Just happened, sir. I think it is doable, sir.
Time to thank and whom all you want to thank. They have stood by
So
you in this career.
first of all, I really want to thank my parents. So my mother and father, they have treated me like a small little kid. So who treats like a 29, 28-year-old surgeon who is sitting in a one room, closed doors, and the parents are getting their food, tea, coffee, and they have been so supportive. My sisters, my co-PG, Dr. Shashikant, he got AML 13, Dr. Menak, he got AML 15, all of us from the same batch. So we did, I think, and my entire seniors, my department at general surgery, my HOD sir, Dr. Manoj Kumar sir, and all the experiences that I've had, the multiple conferences, so many people to thank, sir. I really want to thank Speed. I really want to thank you. So I just feel gratitude, filled of gratitude for everyone, sir, for everyone who has made, from my school teachers till today. I sir feel that interview where you could speak and face the examiners is a culmination of the multiple layers of teachings you have had, from the school where you face your fears of public speaking, to your college days, to your residency where the consultants grill you in the morning. Why does the patient have fever? Why didn't you check pulse? So it just keeps on. Why didn't you see the liver span? And all of these questions then was asked to me in the interview. What is top space percussion? What is normal liver span? Then I started remembering my HOD sir questions in the rounds. Said something will happen someday, and then that will play a big role in your success.
Great, great, amazing share. Thank you for sharing everything that you had in a short span of
Thank you so much.
time. It will be useful for many number of students. Once again, I wish you all the very best and all the success for a great career in MCA Surgical Gastroenterology. Best wishes to you.
Thank you so much, sir. Thank you so much, sir.
God bless you.
Good day, sir.